Welcome to another update of Update 19, compliments of the Ministry of Public Health in collaboration with PAHO WHO. And today we will be getting the latest news in Guyana as to the situation of COVID-19 across the country. And to bring us today's update is our Chief Medical Officer, Dr. Shamdeo Prasad. Welcome, Dr. Prasad.
Good afternoon. I am Dr. Shamdeo Prasad, the Chief Medical Officer of the Ministry of Public Health, and I am presenting today's update on behalf of the Honorable Minister Faldo Lawrence. The total number of confirmed cases of COVID-19 in Guyana is now 55, inclusive of 6 deaths, with a total of 250 persons tested during the period the 26th of February to the 15th of April 2020. The persons who have tested negative total 195, and 8 persons have so far recovered. In our quarantine and isolation facilities, the numbers stands at 25 and 41 respectively, and there are 5 persons in our COVID ICU. Of the 55 positive COVID-19 cases, 4 are known to have travel history, and the other 51 persons contracted the coronavirus here in Guyana. Our confirmed cases in Region 4 represent more than 80%, and most of the cases occur in Georgetown. To date, most of those who tested positive are males. In the over 50 age group, male and females are almost equally affected. However, in the 30 to 49 years age group, most of those who tested positive, almost 4 to 1, are males as compared to females. Our hotline continues to receive calls from concerned citizens, which total a number of 1,966 for those calls. We are extremely happy, and I wish to remind you to use the COVID-19 app as well as the hotline in your regions to seek information on this disease. Globally, according to the WHO, there are 1,844,863 confirmed cases with 117,021 deaths. In our region, the region of the Americas, there are 644,986 confirmed cases with 25,551 deaths. You have been hearing in the news that persons with underlying conditions are more at risk. So let me share with you a little bit more on these conditions. Chronic lung diseases such as asthma and bronchitis, as well as those associated with smoking. High blood pressure and heart diseases, diabetes and high blood sugar in some persons, and diseases associated with immunocompromised conditions such as HIV, cancer, and its treatment, along with lupus and other such conditions. In Guyana, a large proportion of adults as early as those in the mid-20s are affected by some of these conditions and are at high risk for the development of the more serious forms of COVID-19, which results in hospitalization, ICU care, and even death. No one is exempted. Ladies and gentlemen, let me remind you that there is no vaccine, nor the WHO has approved any medication to treat coronavirus disease. The medical personnel will treat you according to the symptoms you've presented, so do not wait to report. I wish to reiterate that if signs and symptoms are present, and especially if you have those underlying medical conditions that I've spoken above, use the app, call the hotline, or contact your nearest health facility for further information. Let us all play our part If you must absolutely leave your home, remember to cover your nose and mouth. Remember, wash your hands properly, cough and sneeze into your elbow or a tissue that you must discard carefully. Most importantly, stay 6 feet apart from each other. Stay at home and stay safe. Good afternoon.
Thank you, Dr. Prasad, for those information, and I trust that you have listened very keenly, and there is something in it for you and your family and for those around you. I am Terence Esibum, the head of the Public Relations and Health Promotion Unit of the Ministry of Public Health, reminding you to stay healthy, stay safe, and stay home.